The following is a special presentation of KDOW. Money Pulse. Monitoring the heartbeat of money. From Wall Street to Main Street to your wallet. Now here's your host, Dynasti Young.
All right, welcome to the Money Pulse, everyone. Thank you for tuning in. Today, I welcome Lindsey Pollaczek. Hi, Lindsey. Thanks for coming in today.
Great to be here.
So, Lindsey is the Chief Partnerships Officer with Fistula Foundation. That's amazing. Can you tell us, Lindsey, a little bit about the foundation and what you guys are all about and what your position is? I understand you've been there for about a decade, so I'm sure you have lots of insight to share.
Absolutely. Well, it's great to be here. And so I'd like to just start by telling you what fistula is, what obstetric fistula is.
Yes, please.
It's a childbirth injury, and it's most often caused by prolonged obstructed labor. So when a woman can be in labor for hours or even days, but doesn't have access to the emergency C-section that she needs. And a fistula is a hole, and it's a hole between the bladder and the vagina or the rectum that causes incontinence. And so this incontinence is a physically devastating injury, but it also has severe social, psychological effects. So there are women, about 1 million women living in Sub-Saharan Africa and South Asia that currently have untreated fistula.
1 million?
1 million women.
Wow.
And Fistula Foundation is dedicated to ensuring that those women have access to the surgery that they need that can repair their fistula, restore their incontinence, and improve their quality of life. So that's what we do at Fistula Foundation.
That's awesome. So yeah, you can really understand that can change a woman's whole person by suffering from something like that, like the mental part, like you said.
Absolutely. It's extremely socially devastating, psychologically devastating. I've met women who've described what it's like to live with fistula, the stigma that they experience, the ostracization from their families, from their communities.
From their families, too?
From their families. Women are abandoned. Oh. Many are divorced by their husbands when they learn that they're leaking
because they're broken,
urine, they're smelling. Some women are even told that it's their fault that they've developed this fistula.
That's tragic.
It's a terrible injury. It really devastates a woman's life and her ability to interact with her family and her community. But what's really incredible is that there is this solution, and it's very straightforward and easy to provide. So when I was in Tanzania back in 2008, I was learning about fistula for the very first time. I met women on the ward at this hospital who told me about their experience living with fistula, and I met the doctors who could provide this reconstructive surgery. And I thought, oh my God, here's this thing I never knew even existed, how much it destroys a woman's life, and that there's a solution, and it's available, and we just need to raise the visibility about these women and about the solution. And so that's why I've been doing this work for over 15 years.
Over 15 years.
I feel so inspired by seeing women healthy and happy again.
A woman for the women. I love that. So you said you spoke with some of these women, and I can only imagine the adjectives that they would use to describe their feelings about their self. Can you share a little insight with those kind of, feelings that they shared with you?
Yeah. There have been so many women I've had the opportunity to meet, but I'll tell you about a woman named Khadija, who I met earlier this year. I was visiting northern Nigeria, and I was out on a site visit with one of our terrific partner organizations, and we had the opportunity to go to Khadija's home. And as soon as our car pulled up, Khadija ran out of the compound laughing and singing and skipping.
Literally singing?
Singing, just welcoming us
grateful.
To her home. So grateful, so full of joy. And then she welcomed us into her home, and we sat on the ground, on the floor of her home, and she told me about her experience living with fistula. She had an excruciating labor. She was in labor for 4 days.
Oh, my goodness.
By the time she finally made it to the nearest health facility, tragically, her baby was stillborn. And she had developed a fistula, which meant she was leaking urine uncontrollably.
Oh, my goodness.
And Khadija didn't know what was happening. The nurses at the health center didn't know what was happening. And so she left and went home, moved in with her mother, and just, it devastated her life. She said she couldn't go out in public. Anytime she went out, she felt people were laughing at her behind her back.
So self-conscious.
They wouldn't look at her face. They would look at her legs to see if they could see leaking urine down her
legs. Are you serious?
When she went to bed at night, she would wake up in the morning covered in urine with urine up to her hair.
Oh, my poor thing.
And so she and her mother spent most of their days just trying to clean her clothes, sort of remove the smell of the urine.
Right.
And it just absolutely devastated her life for 9 years.
For 9 years.
Fistula.
I see why she came out singing and praising and
so of
skipping.
Course,
yeah.
When she finally learned that treatment was available through a community health worker, she leapt at the chance to receive that treatment, and thank God the surgery was successful. She's now dry. She's not only healthy, but she's learned a new skill in tailoring.
Oh, nice.
And when we were there, she was preparing outfits for Ramadan. She was excited to be back in the community, sort of advertising her new skills and that she could make clothes for Ramadan season. So it was just such a powerful example of how fistula surgery is so healing and transformative for women.
Yeah, I mean, she just rebuilt her body, but it rebuilt her person, her spirit, her confidence, and gave her motivation to be a contributor to her community and be a very joyful one.
100%. Yeah.
Wow, that's powerful. So, I'm sure you know this answer, but I'm curious. You said it's easy to, I mean, not easy, but it's we're able to facilitate this with, little movements, and we can actually, this is pretty easy to connect people and get people aware of this tragic injury, birth injury, and there is a resolve to it. So is it an expensive surgery to perform? Like, is that something that's quite costly?
Remarkably, it's extremely cost effective. So
really?
On average, the cost of surgery across our global network is only $633. So that's
what was that?
$633.
Wow.
To completely transform a woman's life, restore her health, her ability to work, her ability to return to her family and her community. It's one of the most cost-effective health interventions that there is in global health. And that's what Fistula Foundation, working with a network of 150 hospitals and community partners across 35 countries, really stays laser focused on delivering this cost-effective surgery. We know that it not only transforms a woman's health, but it also enables her to return to a productive life working in her community, like Khadijah, able to go back to work again. So it not only changes lives, but it unlocks a huge economic potential for these women to go back and work again.
Absolutely, which then just builds on their society, their community, their surroundings, and it's only $600, a little over $600. Wow, that's an incredibly interesting thing that we can be aware of for sure, because you said over 1 million women are suffering from this birth injury that is resolvable, is curable, is fixable. And after 9 years, Khadijah suffering, she was able to restore herself and restore her happiness and even get better, I think, probably than what she was before.
Exactly. And because most women do develop fistula in their 20s, providing early treatment can really restore over 4 decades of healthy life. So eliminating 4 decades of suffering and really helping those women return back to full health early. So we know that sort of yields dividends over many, many years.
It was like early intervention is best, but it is also resolvable if it was a long-term issue as well. Well, that's great. If you're just tuning in, we're here with Money Pulse with Lindsey Pollaczek from Fistula Foundation. We're just discussing the impact that this organization is making on so many women that are impacted by this birth injury. And it's more than just an injury. It's a mental restoration project as well. And we love that here. We love to hear those stories. And thank you so much for sharing, Lindsey. So You have a nonprofit here, and if we wanted to get involved or learn more, we should go to the website. Is that the best place? FistulaFoundation.org. And that's FISTULA Foundation.org. Is that correct?
That's right. Yes.
Okay. And so, can we donate? Can we volunteer? What does it look like on your website? Like if we want to do more than just learn about it?
Yeah, well, we'd love to invite you to learn more. Our website has a lot of great resources. You can learn more about what Fistula is, the partners that we work with across Africa and Asia. And of course, because it is the giving season coming up and we have Giving Tuesday, we now have an opportunity for contributors to have a gift matched up to $150,000. So that work is going to support our amazing partners in Angola, a country that's been ravaged by decades of civil war. We have amazing partners on the ground that are providing care to thousands of women. We had a surgeon visiting us from Angola just a couple of weeks ago, talking about the huge need that exists in the country, the number of women that are coming out of the shadows seeking care. So we would really love for you to learn more about our work in Angola and get involved. And yes, you can visit our website, www.fistulafoundation.org.
Amazing. And don't forget Giving Tuesdays. Is that every Tuesday?
Giving Tuesday is right after Thanksgiving.
Okay.
So from now until essentially December 3rd is when we get in the giving spirit. And
yes,
so,
absolutely. We do too.
Thanksgiving, and then we have Black Friday or whatever, the consumer holidays.
Right.
But there's also an opportunity to give back.
Giving Tuesday matching up to $150,000. So that is a beautiful gift. If you are going to give it now. Give it on Giving Tuesday. We'll be back. We're going to go to a commercial break, and we'll be back here with Lindsey Pollaczek from Fistula Foundation. Stay tuned.
Money Pulse, KDOW's financial news magazine, monitoring the heartbeat of money from Wall Street to Main Street to your wallet. You're listening to Money Pulse on AM 1220 KDOW.
And we're back on the Money Pulse. Thanks for tuning in or staying tuned. I'm here with Lindsey Pollaczek from Fistula Foundation, Fistula Foundation. You can look up more information if you're just tuning in, fistulafoundation.org. Really powerful impacts they're making for women with this birth injury. And it's just, I hope you got to hear it earlier, but if you didn't tune in or check out our podcast and listen to the full show with Lindsey Pollaczek, she's been wonderful. She's the Chief Partnerships Officer with them, who's been with them for over 15 years and has made some huge impacts herself. We were just talking about Giving Tuesday and how there's a match up to $150,000 for this special giving season. So we encourage you, if you do want to donate, that's a great time to do so. Double up. But anything is very appreciated. Just learning and being aware of this birth injury is huge as well. You guys, Lindsey, you guys did receive a transformational gift from Mackenzie Scott. Is that correct? Mm-hmm. And how has that changed your capacity and your ability to scale and impact these big communities and up to 1 million women that are suffering?
Yeah, it was really a transformative gift. We're so grateful to philanthropist Mackenzie Scott. We received a $15 million gift in 2023. And as soon as we received that funding, we thought, okay, this money is to help more women get access to treatment. So we didn't put any money away in a rainy day fund. We didn't sort of put it in an endowment. We knew we wanted to deploy those monies quickly and responsibly, but help as many women as we can today.
Wow.
And so we put that money to work, and we increased the number of surgeries by over 60%.
Whoa.
In just 3 years, from around 10,700 surgeries a year in 2022 to just under 17,500 surgeries this year.
That's a huge impact, exponential.
Right. And we did this really by building up and bolstering the capacity of our existing partners, our terrific partner network, and also growing our network. So in 2 years, we grew our global footprint by over 30%. Wow. And we really delivered. And the great news is that, over 10,000 more women have now received surgery as a result of that funding, and we've deployed every penny. And so I think what that shows, though, is there's a powerful proof point that we can quickly metabolize large gifts to help a lot of women.
That was huge. Like, you guys did a great job.
Yeah, I mean, I think we feel that we really were able to help a lot more women. And now our goal is really to continue to build on that momentum. Mm-hmm. We have that network of partners and we know that the need exists. So that's what our goal is now.
Like a real spoken businesswoman too. I mean, Mackenzie Scott's probably very pleased with how those things have transpired.
Yeah, we hope so. You know, we did go through a vigorous vetting process, but really it was about trust-based philanthropy. And we really are grateful for her and her team. They gave us that $15 million gift, no strings attached. They had done their due diligence and saw how the foundation was a lean organization that was run with high levels of efficiency and effectiveness. And so, yeah, we really did sort of take that to heart and put that money to use right away.
Well done. Well done. So you definitely brought a Silicon Valley style business approach into running this nonprofit. It sounds very solid, smooth wheel, just going and spinning. And you seem very perfect for the job at hand here. So what does that look like? What does your approach look like with this business style that you've set up in the model? And how has it helped with your scaling and being more effective and impactful?
Right. Well, I think the first thing is really our very laser focused mission. So like any successful startup, we're really fulfilling a niche specific market and we have a very clear vision on what we are trying to do. So we never really forget what our core product is, so to speak, and that is really delivering cost-effective surgery through a network of skilled providers. So we really try hard to avoid scope creep, mission creep. We really stay focused on healing as many women as possible. And yeah, we don't try to boil the ocean. So I think that narrow, specific focus has really helped us scale.
Yes.
Second, we really run a lean team. So we have very low overheads. We're a lean team here in San Jose and our program team in Africa. We have a small team and we're, as a result, able to deploy 84 cents of every dollar to our program activities. That's in comparison to most charities or average charity, which is about 70 cents per dollar for program activities. And we receive all the sort of highest ratings from Charity Navigator and GuideStar and Charity Watch, all the rating agencies. And then finally, because we are a small team and we don't receive any government money, we can really be very flexible and nimble. And so we're always optimizing, trying to do the best work that we can as effectively and efficiently as we can. And we really take this to heart. We really believe it's our responsibility to our donors and to the women we serve to do this work effectively and efficiently. So we do like to think of ourselves as a sort of a fiscally responsible for-profit company, but of course, you know, for us, the bottom line is how many women can we help?
Wow. Yeah. You do have the business side down. It sounds like you guys are tight on a budget and with the focus, the laser pointed focus, that you pointed out. It's so important when you're running a business or an organization like this, and you're really proving the effectiveness of that and impacting more because you're not, you're fiscally being smart. So kudos to the team, and that is awesome. If you're just tuning in, I'm here with Lindsey Pollaczek, Chief Partnerships Officer at FistulaFoundation.org. I wanted to talk a little bit about your experience. You spent years living in Kenya. How many years were you there?
Yeah, I was there over 4 years.
4. Wow. Mm-hmm. Wow. Okay. So tell me about your experience and how it changed your perspective and how it, kind of structured your leadership within this space. I'd love to hear a little bit about that.
Yeah. I feel incredibly fortunate that I was able to live and work in Kenya for 4 years. It was initially just a 1-year assignment with the Fistula Foundation, and I was just so inspired and motivated and challenged by the work. I decided to stay over 4 years. So lucky to have the opportunity to visit with so many of our hospital partners, go out on outreach with the community health workers, the community teams, and then, of course, interact and talk with dozens, if not hundreds of women who had lived with fistula and understand their experience after having surgery. And so I think what I really learned from my time in Kenya, not only Kenya, but visiting Tanzania and Zambia and DRC and Uganda and all across the region, was that really what women need is a network of care. There's not just one single thing, but it's really that healing network. I like to think of it as a network of care and compassion. And so first they need the fistula surgeon. They need a trained surgeon and a care team that is committed to providing quality care. Doctors like Dr. Mabea, one of the very first fistula surgeons that I met when I moved to Kenya, so committed and dedicated. He was renting out a small house in town in Eldoret, Kenya. He had turned it into a hospital. He had turned the kitchen into the operating theater. Wow. And he even brought mattresses from his own home because there were not enough beds for women to sleep on. So that's the sort of commitment and dedication of the surgeons, and women need that. They also need the community health worker, the advocate, that's out in the community, letting them know that their condition is treatable, that it's not something to be stigmatized or to be shamed by, but it's a treatable medical condition.
And it's not their fault.
It's not their fault. So women like Mary, who actually had a fistula, it was treated successfully, and then she was so moved, she became an ambassador and a community health worker herself. So she could be out telling other women about her own experience, being that advocate for them, helping them get to the hospital and then back to their communities. And really, women need us. They need people who care enough about what they've gone through and who are able to provide the support, the financial support to cover their cost of surgery, to cover their cost of transportation from the community to the hospital. Because even though that $633 is modest by our standards, it's far out of reach for any woman living with fistula. And so really, they need a community of support. They need the doctors, the community health workers, and they need compassionate people like us. And Fistula Foundation is so grateful to work with such a compassionate network of supporters. We have supporters in over 70 countries.
70?
70 countries. Wow. Many people will never meet a woman living with fistula, but they feel extremely motivated and committed to be able to do what they can. A relatively modest investment they know can go a tremendously far way.
Wow. Yeah. And it sounds like you have built a huge team, an exceptional team here on the grounds where we are, but also overseas with all those people. And it's encouraging people to pay it forward. Like, I love that Mary is an ambassador and is encouraging other women, telling them it's okay, because it really does take a village, right? Mm-hmm, kind of how you were describing.
Yeah, there's a great African proverb that I often think about, which is, if you want to go fast, go alone. If you want to go far, go together.
I love that. All right, y'all. Well, I can't believe it's already over, but please check out fistulafoundation.org. And thank you, Lindsey, so much for coming in and educating us about this. I really appreciate you coming in today.
Thank you for having me. It's been a pleasure.
It was my pleasure. Thank you.
This has been Money Pulse, KDOW's financial news magazine, monitoring the heartbeat of money from Wall Street to Main Street to your wallet.